Health officials in Santa Clara County are addressing the rise in COVID-19 variants in the county as well as the vaccine supply. So let's listen in.
Clara County. We're here today. We want to make an announcement and share with the public regarding what we're finding in terms of the variants of concern, the SARS-CoV-2 variants of concern. These are strains of the virus that have emerged in various places in the world, and we have now documented are circulating here in our county. So all three, or actually all four of the variants of concern as they've been defined by the Centers for Disease Control and Prevention are here in Santa Clara County. We've had the variant B117 from the United Kingdom circulating here for some time, and then the numbers reported to us are beginning to pick up. This variant is it spreads more easily, it's more transmissible as compared to the regular SARS-CoV-2 virus. We also have had a handful of cases of the South African variant and one report of P1, which was the variant that was first identified both in Brazil and Japan. So this is important to know because we've documented them, the numbers are beginning to pick up, and right now we're in a race between the variants and the vaccine. We have some data regarding the variants and how effective the vaccine is, some but not all. But the top line message is you are far more protected if you're vaccinated than if you're not. And the more people that are vaccinated in our county and in our community, the safer we all are. So what does this mean? This means that we're back in a bit of a precarious place as far as our collective ability to curb this pandemic. It is spring. It is a beautiful day. We all have cabin fever. We all want to get out. We all want to get back to our lives, but we can't do that quite yet. We can't do that quite yet. So I'm calling on every one of us to continue to wear our masks whenever with anyone outside of our household. That includes people who are vaccinated, okay? I also urge everyone, please don't travel unless you really have to. We're not quite there yet. We've got to give it just a little bit more time. Some people have to travel, go ahead, but wear your mask and make sure that when you come back to the county that you quarantine, that you stay away from others. So with that, I'm going to turn it over to Dr. Fensterscheib, who will give a quick update on the vaccine supply and vaccination here in our county.
Thank you, Dr. Cody. Good morning, everyone. So we did get our notification of what we will be getting for next week, what will be arriving next week for our vaccines. And it's the total number, which is not including Kaiser or Palo Alto Medical Foundation, is 71,900 doses. How does this compare with last week? Last week we got just over 58,000 doses. So we did get an increase this week, which is good. Most of the increase that the state got, which again was passed on to us, was for the Johnson & Johnson vaccine. So that's good because that's the one shot and done situation. You get one shot and you're finished. So we're happy to see that we got more vaccine. However, it's still not enough. We're doing about 1/3 of our capacity in this county. So we continue to need more vaccine, but we're happy to see at least a little bit of an increase. When we look at our dashboard to see how we're doing in this community, about a third, a little more than a third of residents that are eligible, those are 16 and older, have been vaccinated with at least one dose, so that's good. Those that completed the whole series are about 20%. So 1 in 5 people are totally done with the series of vaccine, but as Dr. Cody mentioned, we really need to get people vaccinated. We know that there is a limiting factor of how much vaccine we have. So again, people need to just continue to check all of the websites and make sure that when it is your turn, that you find an appointment and get vaccinated. Today, April 1st, opened up the vaccine eligibility yet again to include 50 years of age and older. So that will be added to all of our eligibility at the clinics. That equals a lot of people. I think I mentioned at one time previously that it was about 370,000 more people, but probably a little less because some of those people already fit into some of the other categories. But still adding a lot of people that we don't have vaccine for now. So please, everyone, be patient. And as Dr. Cody said, please protect yourself because we do not want the variants to cause a problem with people that have not yet been vaccinated or even develop additional variants, because the more the vaccine, the more that the virus is allowed to replicate, the more chance there is for additional mutations and additional variants. So again, be patient, continue to check the website, our website, sccfreevax.org, and you'll find an appointment, hopefully, if not next week, in the next couple of weeks. We are told that the vaccine supply should increase by the middle or end of April and well into May for sure. Thank you.
We'll now open up for questions in English. Please identify your questions for. We will call on everyone individually. We'll start with KCBS.
So this is a race between the variants and the vaccine, because the more opportunity that the virus has to circulate, the more opportunity it has to take on mutations and to change. So we've already seen a few variants of concern emerge, and what we want to do is get our population here and really globally to get vaccinated as quickly as possible to reduce that opportunity.
NBC, that's a question. What for Dr. Cody and one for Professor Pratt? Are we on the verge of headed backward if this continues, going back to more restrictions? We don't social distance, wear a mask, go out.
The trends that we're seeing here in Santa Clara County are somewhat similar to the trends in our Bay Area region. And that is after really good progress and consistent declines in positivity rates and case rates since the first week in January, we are now seeing our case rates flatten, and in some cases some indication that they're beginning to tick up. So we may have gotten as low as we're going to go. We're about where we were last October, mid-October. And as you will remember, after mid-October, starting early November, our case rates started to tick up quite precipitously. So unfortunately, we still all need to be very aware and very cautious to prevent any surge or even a swell. We don't want that to happen.
And for Dr. Spencer, I'm certain that there's obvious frustrations with people who can't make an appointment. Some are looking at Fresno, see if they can get in Fresno. They're asking why open it up to 50 and over when we can't even supply to 65 and over right now. It just answers that question.
Right, so the question is, why are we opening up even more when we can't meet the needs? It's a good question, and we're taking the lead, excuse me, in a direction from the state. So that was not our decision, that was the state's decision. Excuse me. I wanted to make just add one more thing, because I mentioned 71,900 doses. Of those, about 49,000 are first doses. So all second doses were covered, and we have less that we needed to do for the next week. So there will be at least 49,000 doses of vaccine that will be opened up for appointments for next week, which is more than we've had in the past. And I wanted to make that very clear.
KTVU?
Question for Dr. Cody. Can you tell us why you say it's important for people to wear masks when everyone's been vaccinated and groups of people that have been vaccinated, even if I guess it says that's different from the CDC guidance?
So the question is, why is it important to wear a mask even if you've been vaccinated? The reason why it's important to keep wearing a mask is because not everyone has been vaccinated. The proportion of people who've been vaccinated is not near the level of herd immunity. So that's number one. Number two, while being vaccinated provides excellent protection against severe illness and death for those who are vaccinated, it's not 100%, no vaccine is. So wearing a mask gets you, really close to perfect protection. And it still protects others. While most people who are vaccinated, the evidence is that you're very unlikely to spread the virus, it's not zero. And given that these variants are spreading, we really want to do everything we can to keep them from spreading. And if everyone continues to wear their mask, that will really help these variants from getting a foothold. Thanks.
City News?
The question is the vaccine less effective for these variants of concern? The answer is this is still under study. There are two types of data that we are collectively looking at. One is laboratory data, and there's some evidence from laboratory data that some of the vaccines may not perform as well with these variants. But more importantly, there's the what happens in real life when there's people who are vaccinated in a community where the variant is circulating. Those data are obviously fairly incomplete, but still coming in.
Carolyn?
Two quick questions. One, is there any evidence that the number of people who have been vaccinated is having an impact on overall cases so far? And second question, has there been any long-term conversations about booster shots to deal with variants?
The first question is, have vaccinations had an impact on case rates? And the second question is, what about booster shots? So we've seen significant declines in case rates and positivity rates across the state, the region, and our county. This has to do with, I think, both increase in natural immunity. A lot of people got infected, and we have increasing vaccination rates. So I think it's both. There is conversation around booster shots. Our best guess is that SARS-CoV-2 may require, annual booster shots, something akin to getting your annual flu shot. We all may need to get our annual SARS-CoV-2 shot.
KPIX?
So this is a question for Dr. Cody. If one of the existing variants or one that emerges later kind of defeats the vaccine, aren't we essentially back at square one?
The question is, if one of these variants defeats the vaccine, aren't we back at square one? So I would say the good news is that we have a variety of vaccines. Each of them work a little bit differently and may provide, too soon to tell, but different levels of protection. The key is, though, to overall tamp down the spread of the virus. And if we tamp down the spread of the virus, it will help everyone, right? It will help everyone. That's the key.
Just a follow-up for Dr. Vincent's side, if I could. So I was looking at recently a map of the Bay Area with vaccination rates by county. There are other counties led by Marin that have half of the folks who are vaccinated. Why has there been such a lag in Santa Clara County relative to other counties in the area?
So why is there what you observed as a lag in this county as opposed to some other counties? I don't think there is a lag. We are using all of the vaccine that we are allocated. So as I mentioned, we are only at 1/3 capacity. So as we get the vaccine, we are getting it out, at least the data looking at our county system, we are utilizing our capacity 99% of what the vaccine is allocated to our community. So it's not an issue here, it's an issue of what we receive. And we have a big population here, and we're also focusing on our equity and our underserved population. So we're using everything that we get. And as we get more, we'll increase it even more.
I don't think there's been any suggestion that they're sitting on existing doses, but other counties are further ahead. I mean, what's the explanation?
I think it's a supply issue. And so we're a county of nearly 2 million people, the largest in Northern California. And so the allocations are not going as far in our county as others. But again, as more is received, we will quickly increase that from that 35% on up and getting everyone done.
The question is around testing. We are seeing a little bit of a slump in testing. The rates of testing are drifting down. They're drifting down faster statewide than they are in the county, but this still is an area of concern. So the question is, when should you be tested? Let's not forget that testing is a really important strategy to prevent transmission of COVID. So if you are working somewhere where you have frequent exposure to the public, you have frequent exposure to others, you should get tested regularly. How regularly depends on how much exposure you have, but once a week would be fantastic, and it should be at minimum once a month. Second, if you are exposed to someone who has COVID, you need to quarantine immediately and then get tested around day 7 is what we recommend. And if you have any symptoms of COVID, you should get tested. So we still have widespread testing available. There's plenty of access. There should be no barrier to getting tested. And if anyone has questions, you can look on our website, sccfreetest.org, and find out where you can get tested. The question is, do I anticipate there will be another surge? Unfortunately, if we can't get more vaccine supply, and if we can't get continued adherence to behavior change like masks, we do anticipate that we'll have another surge. I would hope that it would be a swell, not a surge. I think vaccines are going to help, but we need more supply so we can get it out faster. And we need people to just hold on for a little bit longer. Keep wearing your mask, delay your travel, don't indoor dine, don't go to indoor bars, don't host an indoor gathering at your home. Even if it's allowed under the state rules, don't do it. It's not safe, not yet. I think of a surge as large and a swell as mild.
So do I think the county will reach its goal of at least 85% by August? I do. I'm optimistic that the production numbers are going up. And again, the vaccine will be flowing probably to a lot of our local pharmacies, also directly from the feds, and to our federally qualified health centers also. So vaccine should be coming in from a number of places. And I think by the time we reach the midsummer, we'll be where we need to be. Right, so what percentage of Santa Clara County has been vaccinated? So we look at two things. We look at least one dose, and that for 16 years of age and older, those are the eligible criteria, and that is about 34%. So a third of our county that has had at least one dose. And if you look at how many of all of those of our entire county have completed the whole dose series, either 2 Moderna, 2 Pfizer, and 1 Johnson & Johnson, it's 20%, so 1 in 5 are totally completed in their dose. Yeah, so is there a problem with the supply and production in Johnson & Johnson? We don't know that. The state did get a very large amount of Johnson & Johnson allocated for next week, over 500,000 doses. And we don't know yet whether that problem at the production line is going to affect us into the future.
Doctor, the state hasn't changed anything in terms of the guidelines in regard to travel yet, and yet travel is definitely ticking up. Can you just elaborate more on why people need to just hold off?
The question is around travel and why people need to hold off. So there still is a travel advisory that the state has discouraging non-essential travel, discouraging travel for pleasure, for example, discouraging travel for spring break, for example. The reason why we discourage travel is that travel exposes people who live in one area, go to another area, may pick up a new variant or a new strain and bring it back and then mix and things take off. I would say that our county historically, just because of the demographic mix, people have family from around the world, people have work that takes them many different places, we tend to see unusual infectious diseases emerge in our county. So it is really especially important that we pay attention and not travel right now. If someone does travel because they have to, it's essential, we urge people to, 1, wear masks consistently, and 2, quarantine when you come back. That means you come back and you stay in your residence for 10 days.
Final question, KPIX.
Yeah, across the Bay Area, we've gone pretty quickly from purple to red, orange, some looking like yellow maybe in a couple of weeks. It's my understanding that you've always had the authority to sort of enact restrictions tighter than what was recommended by the state. If you're concerned about surge or swell, any chance that you will put the brakes on what any further reopening in our country?
This question is around state and local restrictions and whether we would consider something local if there is a surge or a swell. The answer to your question is very complicated. As we know, the larger a population that makes a change, the more effective it is. And so as the pandemic wears on, it becomes more and more difficult to do something locally that is more restrictive than surrounding counties and than the state. However, my job, whether I like it or not, is to do what I think will best protect the health of people living in our county.
Is that a maybe or a yes? Or too soon to tell?
That's a too soon to tell.
Thank you, everyone. Appreciate it. Thank you, Dr. Cody and Mr. Fett.
All right, that concludes our English and American Sign Language portion of the press conference. We will now be moving into the Spanish statement from the podium. Muy buenas tardes, mi nombre es Ricardo Romero Morales, soy oficial principal de información pública para el condado de Santa Clara.
We've been listening in on a press conference with Santa Clara County health officials talking about the various variants and vaccine rollout within the county. We do have Chronon's Charles Clifford on this story. He'll have a breakdown on everything that was discussed at this press conference a little later on today. But for now, you're watching Chronon. We'll have more news for you coming up after the break.